This is the segment we like to call What's Up, Doc, where we spend some time with the healthcare experts at Mercy Health. This morning is no exception. Now, normally we say, let's welcome Dr. Well, that's not what we're doing this morning. We have Mary Farley on to talk to us about pediatric urology, and we want to get Mary's titling and credentialing right. Let's let her do it. Mary, good morning.
Hi, good morning.
How are you this morning?
Good this morning.
How do we refer to you official title-wise?
Nurse practitioner. I'm a nurse practitioner.
Outstanding.
Well, because Riley, you have an alphabet soup in front of you right there.
I really do. I'm
yeah.
looking at you. Mary Farley, MSN, APRN, FNP-BC. Now,
Yep.
that could be your license plate number. What do all those things mean?
It means I have a master's degree in nursing. I am an advanced practice RN, which is an NP in Illinois. That's the Illinois licensing. And then I'm a family nurse practitioner, board certified by the American Nursing Credentialing Center.
See, we're like a minute in. I've already learned stuff.
That's very good. So, how long did it take you to get all those letters? How much schooling did that take?
Well, I had a bachelor's degree in nursing, so that was 4 years. And then I had another 3 years for my master's for my nurse practitioner.
And where did we matriculate for our bachelor's and master's?
I originally went to Winona State up in Minnesota for my bachelor's, and then I went to a tiny little school out in Spring Arbor, Michigan for my master's program. So,
All right.
Joe normally, he has to make sure your college bona fides. Not that you're prepared for your job, but if it's okay, he might root against your college team.
Winona has a great tennis program up there, so that's fine.
Well, everybody knows that.
Yeah, everybody knows Winona's known for their.
Are they ever?
For their Division II tennis prowess up there. Yes.
Mary, tell us about pediatric urology. What is it, and fill in some blanks for us.
Yeah, so pediatric urology is urology for kids.
Okay. It's taken me 3 days to come up with that.
Checks out.
Yeah, no. So we see a lot of urologic conditions, but for children between the ages of 0 and 18. So we're seeing kids for recurrent UTIs. We're seeing kids for incontinence issues. I'm working with a phenomenal surgeon, Dr. McKenna. So he sees a lot of the surgical cases like the hypospadia or hidden penises, hydroceles. He's seeing them and then taking them to surgery. I'm seeing more of the medical stuff and taking care of them in the office. So.
All right. So when I hear urologist, I generally think of as an older generally male problem. That's my bias right here. When do people...
You think only old guys deal with pee? Is that what you're saying?
Yeah, that's exactly what I'm saying, Rob.
Okay.
Well, everybody pees, so there's always issues throughout the age group.
Mary, one of the things we figure out on this show is the dumb things that I think, and then I just say those out loud.
And then it's your job to correct him and put him on the right path.
Like, no, Joe, as a matter of fact, everybody does pee. That's that is how it works. How young are you seeing patients?
Well, Dr. McKenna will see patients antenatally, so he'll see some patients that are still in mom's belly if they're having some hydronephrosis or some issues like that. And then once they're delivered, then we see them in the clinic. We go all the way up to 18, so before birth to 18. So.
Outstanding. I know that bedwetting is a thing. It's a common problem among kids. How common is it, and at what point does the parent go, okay, this has gone beyond being a bit of a nuisance and an occasional trouble to something we should look into?
Yeah, so it's a really common problem, especially for kids. Well, obviously, most kids under the age of 5 or 6, they can still have bedwetting, and it's completely normal developmentally. After 5 or 6, you still have a 15 to 20% chance that you're going to have a kid that's having bedwetting. As they grow older, there's a 15% chance of spontaneously it resolving. Otherwise, a lot of kids developmentally might not be ready to potty train at 5 or 6. It's really kind of dependent on the kid. But we do see a lot of these issues in the office, and we can run tests. We have non-invasive screenings and determine what exactly is causing it and hopefully help fix it.
Do you guys generally go after bedwetting as a physical problem or a mental issue?
So it's more of a physical problem, but we do find that kids that either have developmental delays, neurologic delays, well, neurologic delays for sure, but developmental delays tend to have more bedwetting, and then they grow out of it as they get older. But so we approach it from the physical aspect with the mental in the back of our mind.
See, I'm old enough to recall when it was dealt with in very cruel manners, because I can remember a neighborhood kid when I was small who was having some difficulty with that, and mom hung the sheets out for all to see as a way of embarrassment, making this go away.
Oh goodness!
I'm guessing that's probably the least successful approach.
Usually, yeah. We would probably recommend not hanging the sheets outside.
Right.
Unless you're washing them. And
it was horribly mean. I mean, even as a kid, I remember thinking, God, that's cruel. Because every other kid knew it, and kids being kids, cruelty was on free display. So this is where you and your expertise come in. Don't do something like this. Make a phone call.
Right. Yeah. Reach out to your primary care doctor. They'll be the first ones to tell you whether the kid's developmentally appropriate and, maybe we should pursue this further, or whether you got to give the kiddo a couple more years or a couple more months even, and they'll grow out of it.
How should a parent address bedwetting? If we're not to the point where we need to call somebody about it. Is it something that you should address with your kid and talk about it? It's a normal thing, or just ignore it and it'll go away on its own?
So the best thing that I would recommend is to not make a big deal of it, but to address it head on. So say, I know we're having these wetting at night. Let's work together to try and fix it. The more you yell at the kid, the more likely it's going to get worse because you're stressing the kid out. So you want to address it because the kid needs to know, hey, this might not be normal, but let's work on it. But you don't want to yell at them or embarrass them because it might make it worse.
Is this something that sometimes it does not resolve itself during youth?
Yes. Yeah. Up to, I think we've got 1 or 2% of kids can continue to have it up into their teens. Actually, I think it's 2 or 3% up into their teens, and then even 1 to 2% up into adulthood. So it is something that can follow people. Yeah,
and this is something I've got to believe has got to be dealt with delicately on the psychological level.
Yeah. Yeah, because stress and emotional, it does play a factor into how they're feeling and how they're going to react to it. So.
Is bedwetting one of the bigger percentage of patients you see?
I would say yes. The bedwetting, the incontinence, and the frequent UTIs, the urinary tract infections, the reflux, those are kind of more of the patients that I see in the clinic. And a lot of times the patients that have the reflux or the UTIs also have some level of incontinence to go along with their issues. So
when you say reflux, my first thought is acid reflux. That's not the same thing you're talking about, though, right?
No, vesicortical reflux is where the urine that's supposed to stay in your bladder starts refluxing back up into your kidneys. It's not supposed to do that.
Okay.
Is that painful?
If the kidney starts to swell more than it's supposed to, yes.
And urinary tract infections, common?
Yes and no. It's more common in females than males, unless they're under a year, then it's more common in males. But it depends. We do see a lot of UTIs, so.
Now, obviously, if bedwetting is getting to be a problem, parents will contact you. What are the signs will a parent see in their kid to know that it's time to contact the pediatrician urologist?
Well, I mean, if bedwetting is causing a significant impact on the life factor, we like to look at the overall life of the child, and is this really causing an issue? Are they going to friends' houses and having accidents and having embarrassment? Or is it just a once a month or once a year issue? It really depends on the child. If, like I was telling you earlier, if they're developmentally not appropriate, like if they're still having accidents during the day and night, you might want to start bringing it up to the pediatrician, and they'll refer you on to me. If they feel like the kid is developmentally appropriate and now having regressions or issues. So.
But this is definitely something that if you feel that you're not getting a handle on it, and or you find your own your own temperature rising over it, and you don't want to chew anybody out or take it in that direction, these are all indicators that you should pick up a phone.
Yeah, definitely. The only caveat to that is if the child is not developmentally ready to be potty trained or to stop bedwetting, it's ultimately up to the kid. They're going to have to learn how to stop bedwetting. If they're not developmentally ready to do that, you're still going to have to wait until they're ready.
Yep, there's still going to be some more time put into it. What
Right.
makes the pediatric urology program that you have so unique?
Well, we have the only full-time pediatric urology program in Rockford. There are a couple other places that have pediatric urology, but they're only part-time. They're not here every day of the week. We are. We also have, like I was telling you, Dr. McKenna, he's been in the pediatric urology field for more than 30 years. So we are a very strong pediatric urology department. We also have a biofeedback program that helps with the urinary incontinent patients, teaching them to retrain their muscles so that they don't have so many incontinence issues.
All right. But before we let you go here, dude, is there anything we didn't get to? We didn't unearth any good info from our extensive line of questioning?
Yeah, we hate it. You have you hang up the phone and go, well, those idiots never asked me about this.
I don't think so. I think we covered a decent amount here. You kind of covered the majority of my patients.
So somebody listening now shouldn't go about trying to make a direct contact appointment with you, but should go through their pediatrician. Am I right?
So ideally, yes. You should always check with your pediatrician because they'll tell you, if the kid's developmentally appropriate or if it's an issue and should be referred on. So the pediatrician will be able to give you the appropriate referral to see me or Dr. McKenna.
All right, there you have it. She's Mary Farley. She has a whole bunch of letters after her name, but let's go with nurse practitioner being one of the many, many highly developed skills that she has, including straightening us out on a few things as well. Mary, thanks a lot for taking time out of your day. We really appreciate it.
Thank you. Have a good day.
You too.